You had bariatric surgery, or you're preparing for it, and now you want to know how much weight should I lose in the first month? Where should I be at 3 months, 6 months, or even a year? And the question almost everyone is secretly worried about: am I losing enough, or am I already falling behind? Today, I'm going to walk you through the typical bariatric weight loss timeline from the first few weeks through a year and beyond. Hi, I'm Grace. I'm a physician assistant who's been working with bariatric patients for 20 years. This video is for general education only and should never replace the recommendations of your bariatric team. Now, let's jump into the milestones. Month 1. This is often when patients see their most dramatic week-to-week changes on the scale. Immediately after your surgery, you're progressing through liquid and then soft food phases. Your portions are extremely small, your caloric intake has changed substantially, and you're also losing fluid retained around the time of surgery. The average weight loss during this first month is anywhere from about 10 to 20 pounds. But, and this is important, there is no single number that every patient should lose during this time, because a person starting out at 450 pounds may lose considerably more weight than someone starting at 250 pounds, even if both patients are making excellent progress on their own. So when you're wondering if you're on track or falling behind, remember, your procedure matters. Your starting weight matters. So do your age, sex, medications, medical conditions, activity level, and individual physiology. During month 2, don't panic if the scale suddenly stops for a few days, or maybe a bit longer. The infamous early postoperative stall often occurs within the first couple months. Your body is recovering from surgery and adjusting to major changes in hydration, nutrition, and metabolism. So again, don't worry, a brief stall does not mean your surgery suddenly stopped working. And speaking of stalls, how do you know whether it's really just a normal stall or something that needs attention? What I recommend, look beyond a single weigh-in. Are you following your program's nutrition plan? Are you meeting your protein and fluid intake goals? Are you avoiding frequent grazing and high-calorie liquids? And is your overall weight trend moving downward across several weeks? So don't be too hard on yourself. Treat one scale reading as a data point, because it is just that. It is not a verdict. Month 3. By 3 months, most patients are still losing weight fairly rapidly. You will likely notice clothing becoming loose, your face changing, and everyday movements becoming easier. You may also see improvements in blood sugar, blood pressure, mobility, and sleep apnea. Some patients lose several pounds per week during this period. Others lose a little more slowly. By the end of month 3, average weight loss is about 10 to 15% total body weight loss. Weight loss also continues to happen in more of a staircase pattern. Drop, pause, drop, pause. It will not form one perfectly smooth diagonal line, although wouldn't that be ideal? The main thing during this time is, as tempting as it may be, don't compare yourself to other people's weight loss results. Instead, compare your current trend with your own starting point and with the expectations established by your surgical program. And remember, pounds are only one type of milestone. Being able to walk farther, your prescriber taking you off one or more medications, sleeping better, being able to fasten that airline seatbelt without an extender, and being able to cross your legs for the first time in years. Those are real clinical and quality of life victories my patients happily and frequently report at their clinic visits. Don't let the scale steal those pleasurable victories from you. Month 6. Between months 3 and 6, most patients are losing about 5 to 8 pounds per month. Once you reach the 6-month milestone, patients may experience as much as 20 to 30% total body weight loss. Now, of course, this is dependent on which weight loss surgery you had performed. Weight loss is often still significant at 6 months, but the rate at this point may begin to slow. Now, that slowing is expected. As your body becomes smaller, it requires less energy to function. So a slower rate of loss does not automatically mean you've done something wrong or the surgery has failed. However, if your weight trend has stopped for an extended period, this is a good time for an honest review, not a crash diet. So ask yourself, are portion sizes gradually increasing? Have protein-focused meals been replaced by all-day grazing? Are liquid calories sneaking back in? Has activity decreased? Most importantly, have you stayed connected with your bariatric team? Answer answer is not to punish yourself. The answer is to identify what has changed and get the right support early. Month 9. By 9 months, you will likely have lost a substantial amount of weight, usually about 3 to 5 pounds a month between months 6 and 12, but the scale may move a little more slowly and stalls may last a little longer. This period can be psychologically difficult because the dramatic feedback of the early months is starting to fade. That means your habits become more important precisely when the scale becomes less exciting. Consistent meals, adequate protein, hydration, vitamin supplementation, resistance exercise, sleep, and follow-up care may not produce a thrilling overnight drop, but they are building the foundation that helps protect your result long-term. Here we are. Now we've hit the 1-year mark. At 12 months, patients may lose as much as 22 to 38% of their total body weight. Maximum weight loss is often reached somewhere between 12 and 24 months, not necessarily on the exact date of your first surgiversary. Is that a word? I don't know. It is now. The average amount of total body weight lost varies by procedure. The most weight loss is usually seen with the SADI-S or SADI-S, and the gastric bypass generally produces more average weight loss than the sleeve gastrectomy. However, all these procedures can produce substantial and durable results. By now, you may also have experienced major improvements in obesity-related diseases. Your medical team may even have been able to decrease or remove some or all of your medications. It's an exciting time for sure. Now, here's the scary part for many people. What happens when the scale reaches its lowest point and then starts to go back up? So here we are at years 2 through 5 and beyond. Around 2 years after surgery, many patients enter the stabilization phase. And stabilization does not mean your body weight will remain frozen at one exact number forever. Small fluctuations, of course, are normal. And some degree of weight regain after reaching your lowest postoperative weight is also common and does not mean your surgery failed or you failed. Patients maintain an average of about 25% total body weight loss at 5 years after surgery. And remember, the goal is not to cling desperately to that lowest number you ever saw after surgery, especially if you're performing weight training and adding muscle mass. The goal is durable improvement in obesity, health, function, and of course, quality of life. That requires long-term follow-up because obesity is a chronic disease. Over time, nutrition needs can change. Vitamin deficiencies can develop. Hunger or food noise may begin to become factors. And some patients may benefit from additional nutrition support, behavioral treatment, medication, endoscopic treatment, or revision surgery if needed. Needing additional treatment is not a moral failure. Chronic diseases frequently require more than one treatment or treatment adjustments over time. So back to the original question, are you on track? Your answer cannot be determined by one viral before and after bariatric surgery story, a 1-week stall, or someone else's weight loss total. Your weight loss timeline is a clinical journey for you, not a race against somebody else's highlight reel. Be sure to look at the direction of your weight over time. Consider your starting weight, medical history, and which bariatric procedure you had performed. Track improvements in health and daily function, and review your individual progress with your bariatric team to be sure you're progressing as expected. If you've already had bariatric surgery, in the comments, please tell me which milestone has meant the most to you so far. It can be a number on the scale, a health improvement, or something you can finally do again. I would really appreciate it because your input can be so valuable to someone else who may be where you were when you first started. Let's celebrate each other's victories below. Be sure to subscribe for clear, practical bariatric education without the hype. And YouTube's algorithm thinks this video is best for you to watch next. I'm a physician assistant, but I'm not your PA. All treatment decisions should be made with your healthcare team. Thanks for watching, and I'll see you in the next video.